Let's talk about painful sex. It's common, it's real, it's happening to a lot of women, but unfortunately, it's not something that a lot of women would want to talk about. And even to their own doctors, people do not want to tell this to their healthcare providers because of how sensitive this kind of issue is. However, in this video today, I'm going to be telling you some of the reasons why some women can have painful sexual experience and some of the options that are available for women with this kind of experience. Hi guys, welcome back to my YouTube channel. If it's your first time here, my name is Melody and I'm a registered nurse. Please make sure you watch this video to the end. There's a lot of things to learn from it. First off, I'm going to tell you that having a painful sexual experience is not something that is normal. So whether this has been happening for a long time or it's something that you just started noticing, it is absolutely not okay and it is not something that you should accept. One major cause of painful sex is vaginal dryness. So ideally, for every woman, there is a fluid-like discharge from the vagina, which helps to keep the vagina lubricated and moist. However, during sexual intercourse, this fluid-like discharge increases, which will help to keep you lubricated during sex and also allow for the easy passage of the penis during sexual intercourse. One key major player in actually keeping this fluid going in the vagina is estrogen. So estrogen is something that is produced by the ovaries by every woman within the reproductive years. So estrogen is what will help to keep the vagina moist, to keep it lubricated, to keep it thick, to keep it elastic. That is the role of estrogen. However, during the menopausal years, a woman's estrogen will drastically drop, which make it more difficult for them to be wet during sexual intercourse, making it more painful for them to have sex during these menopausal years. So menopause is one key player in dryness, in vaginal dryness, and also painful sexual experience. Another one is that whether you are menopausal or you are not, if a woman is not properly aroused, this fluid-like discharge will not increase. And so there's going to be friction, which will also cause pain. So still on vaginal dryness, there are some medications that we take that also can cause vaginal dryness. A key example is antihistamine. If you have ever taken those antihistamines, you see that when you wake up in the morning, you feel that your nose is so dry. So those antihistamine will also have that same effect on other mucous membranes, including the vagina. If you are regularly on antihistamines, you might find out that you may have more vaginal dryness when you are taking those kind of medications. So still on medications, if you are on hormonal contraceptives, especially those ones that has only progestin. So we have the combined ones and we have the ones that are progestin only. So any progestin only contraceptive, so whether it's the mini pill, the IUD or the implant, if it's progestin only contraceptive, it kind of suppresses ovulation and also reduce estrogen. So remember, estrogen is what is going to help to keep the vagina lubricated. So if you're on those kind of contraceptive, it causes vaginal dryness. And even people who are on combined contraceptive, estrogen level is not balanced, and sometimes because it's synthetic estrogen, sometimes the body does not respond to it very well. So you still end up with vaginal dryness. So if you are experiencing this and it is concerning to you, maybe you can use other alternative or you can even go back to the hospital to see if there are other alternative method of contraceptive if it is something that is actually disturbing you. Also, when you are breastfeeding or when you've just given birth, estrogen level is also very low in the body. So some women might also experience vaginal dryness during this period. Stress, anxiety, extreme dieting, all of these factors can also cause vaginal dryness. So I'm talking about mostly vaginal dryness because if the vagina is dry, the person might likely have painful sexual experience. So menopause, not being properly aroused, breastfeeding, medications, stress, all of these combined can cause vaginal dryness, which will in turn cause painful sexual experience. If you fall into any of this group or if you think your painful sexual experience could be contributed by any of these things I mentioned, some of the things you can do is to use lubricant. There are water-based lubricants that you can buy and use. Also, foreplay is important in sexual intercourse. Maybe you need to slow down a little bit. Avoid any product that will cause vaginal dryness, soaps, washes, pant liners. You try to avoid all of that. And if it is something that is disturbing you and it still persists, maybe it's time for you to seek medical care. Another major cause of painful sexual experience is inflammation, infections, or vaginal irritation. So, whether it is a vaginal yeast infection, bacterial infection, sexually transmitted diseases, or maybe you are reacting to a product that you've used inside there, if any of this happens, you are going to have a painful sexual experience. It could be sore, it could be burning, because there is something happening in there. If you try to have sex with any of these, chances are that you may have a painful sexual experience. The first thing you need to do is to treat an infection. And ideally, if someone has a sexually transmitted disease, you are discouraged from having any sexual intercourse. So if you have any infection or irritation going on there, make sure you have that treated before you have any sexual intercourse. Avoid harsh products down there. In fact, there's nothing that should be going inside your vagina. You can wash your vulva properly with water, but you shouldn't have any product going inside your vagina. So treat infections. Make sure you don't use any product that is harsh for your body. Another major cause of painful experience for women is pelvic floor tension and muscle spasm. So this one is common, and the most common one under this one is called vaginismus. Surprisingly, this is very common but rarely talked about. So this is when there is involuntary contraction when anything tries to go into the vagina. So whether it is the penis, whether it's a medical product, whether it's tampons, if anything tries to go into the vagina, there is involuntary contraction. Involuntary means that it's not something that the woman can control. So this is usually a problem for a lot of women. Some of the causes can be physical and can be psychological. Physical in the sense that there could be an actual issue with the pelvic floor muscles which can cause this contraction. And but psychologically also is that for people who has had a traumatic sexual experience in the past, this can be a way of their body protecting them from having any experience like that again. So it can kind of be a psychological response from a trauma or a bad sexual experience. But this can sometimes also be caused by stress, hormonal changes, infection, irritations. Mostly, what you should know is that there is an involuntary action that is not controlled by the woman. So women who are going through this experience, some of the things you can do is to go for an actual sexual counseling. It might be helpful, especially if it is connected to psychological trauma. Women can also go for pelvic floor physiotherapy. Another major cause of painful sexual experience is deep pelvic floor conditions like pelvic inflammatory disease, fibroids, and endometriosis. So if you have any of these conditions, you're going to feel pain because of the position of, for example, the position of the fibroid. If it is PID, there's going to be an irritation that is happening. All of this is going to cause pain. So the pain can be while you are having the sex. It can be after having sex, you start noticing pain. And also, for example, if it is a pain that is associated with fibroids, you might notice bleeding alongside painful sexual experience as well. This is something that is not normal. So if any woman notices this kind of pain, especially if you're a woman in the reproductive years, you start noticing this kind of painful experience which was never there, that should tell you that something is wrong. You need to track it and you need to see a healthcare professional because that is where you go to get diagnosed and then you get treated appropriately. So the last one that I'm going to talk about is emotional and relationship factors. As you know, sex is not just a physical thing, it's something that is also emotional, especially for women. So if a woman is not emotionally connected, it means that they're going to have difficulty getting aroused. If there is fear, if there is trauma, if there is guilt, a woman feels unsafe, or if there is past sexual trauma, all of these factors can contribute to painful sexual experience for a woman. So what you do in this kind of case is to address what the problem is. If you need to seek external help, it's something that you can do so that you have a better experience. So I'm going to conclude this video by letting you know that it is not okay or it's not normal for a woman to be in pain when she's trying to have sexual intercourse. So if you fall into any of these groups or if you are having pain and you cannot tell why you are having painful sexual experience, you should definitely see a doctor for that. Sex should not be like a punishment or something that is agonizing for you. Thank you guys for watching this video. If you feel this video was helpful for you, please make sure you like it and also share it. It might be beneficial to someone else, and subscribe to my channel. Thank you guys. Bye bye.